everybody, and welcome back to another episode of Co-Immunity
Chronic Ills.
I'm Maddie.
I'm Kyle.
And today we're talking with Luisa about patient-centered care and preparing for appointments. Luisa, tell us a little bit about yourself.
Oh man, okay, where do I start? My name is Luisa Taylor. I am a nurse practitioner. I have a doctorate degree in family practice and nursing, and also a master's degree in public health. I've been a nurse for 10 years this year, I believe. So been doing this for a little while. I've worked in pediatrics, in the emergency room, and in the hospitals in several settings. So doing primary care these days over at Free State Healthcare. And it's been a really fun experience for me.
Awesome.
Yeah, that's awesome to hear. I guess we want to start out what is your favorite part about your job?
My favorite part about my job is that I get to see patients over a period of time. So I get to learn about them, learn about their disease process, help them navigate the muddy waters that is healthcare. And I get to see sometimes, a nice celebration of something, being conquered, or finding a diagnosis, or, just navigating things with them that can be difficult.
So what kind of complexities come with treating patients with chronic illness? How does that differ from obviously your primary care, so you see people with chronic conditions and without chronic conditions? How does the appointment kind of differ with someone with chronic conditions?
So somebody with chronic conditions definitely takes a little bit more time, right? So if I know that somebody's coming into the clinic to see me, whether to establish care or to follow up, and they have chronic illnesses, the time that I give them is a little bit longer than what I would give somebody that's, establishing care or here for a quick, earache or something like that. So time is usually the first place. The second thing is, there's a lot of things that affect the other thing. So if you have somebody with a chronic illness that has a migraine, for example, but they also have MS or some other condition that may affect the migraine, then you have to have a little bit more complex thinking in that. It could be because X, Y, and Z versus just a simple migraine. So it forces you to think about the actual presenting symptom in a more broad term. Not that we don't do that with every patient, but maybe the chronic illness also affects what they're coming in for.
Sure. I know, I just went to my doctor about 2 weeks ago with a whole list of symptoms, and I was having some chest pain. Well, he's like, it could just be heartburn, but it could also be that your lupus is affecting your heart, so let's run those tests. And I don't think necessarily with a patient that doesn't have those underlying conditions, your mind would immediately be like, we need to see if your heart is stretching. And
right.
it's always interesting, comparing, because my brother doesn't have chronic illness, comparing how they talk to him in a doctor's appointment versus how they talk to me, and kind of what route they go. I know patient access is a big passion of yours. What kind of resources are there that are available just in general, not necessarily specific to Kansas, for finding care with primary care providers?
So Maddie, you probably know that I've been in telemedicine for a little while now. Obviously, the pandemic has brought increased access to people who didn't have it before, especially people with chronic illnesses or immunocompromised states that maybe weren't able to get out of their homes before.
Sure.
So telemedicine is a great way to seek primary care. There are some times that, I do need to see somebody in person just to assess whatever's going on. And I'm happy to do that here in our clinic. Our clinic is really nice because I'm able to do either or. If I need to see a patient and they're like, hey, I have this, I'm like, let's just hop on a telemedicine visit. Let's talk about it. Let's see what we need to do. The other thing is Wichita, where we're at now, is nice because there's so many federally qualified clinics that offer services to people who are uninsured, underinsured, and they're able to get maybe procedures donated or see primary care and then get referred to specialists because they have the resources to do so, right? One big barrier that we have, especially for people with chronic illnesses who see several specialists, is that we don't have a way to track everything with an electronic medical record that, you know, communicates with the other, right? That's a huge problem, not just for us, but for the United States in general. And obviously, if we could solve that, that would be amazing. I wouldn't have to be requesting faxes from 16 different providers for people with 16 different specialists to figure out how the heck, what's going on, right? In primary care, you're kind of the manager of all of these things, where you're like, okay, well, you know, somebody's seeing a GI specialist, but also a neurologist, but also an infectious disease provider. And sometimes those people don't know that the person's seeing all those other people, right? And so you kind of become the person that says, hold up, let's see, okay, what did this person say? And then what did this person say? And then what did this person say? And do those plans mesh well together? And so in primary care, you kind of have that. Sorry, I kind of went on a rant there.
No, we love rants.
Good, I'm glad. So, but that's kind of, you know, like accessible healthcare, I think would be amazing if we could get electronic medical records that spoke with each other.
Yeah. And I guess that kind of goes into the next question is, how do you suggest people prepare for appointments when they do have all those specialists? What would you like to see, you know, in a perfect world, or that you've seen come into your clinic?
Yeah, so in a perfect world, and you know, I say this also, I've worked in the hospitalist side of things too. So when somebody comes in with an acute illness, there's nothing better than somebody coming in with a piece of paper that says, I have all of these things. These are the people that manage them. These are the medications that I take. This is how I take them. These are the surgeries I've had. So having a list is amazing. If you're going into like an acute illness type of stage. If you're coming for a primary care appointment, I would say, you know, not only having that, but if you have medical records that you have with you, bringing them to us, because sometimes, you know, fax is such an antiquated thing, right? And yet we still use it to death. Like, it's silly, really, that it still exists. But you know, there's really no better way for us to find out what happened. So if you have those papers, bring them with you along with the list. Definitely, I would say if this is a follow-up appointment and I've asked somebody to keep track of their blood pressures or their blood sugars or anything else, I ask my patients to take a lot of notes, do a little diary of like, hey, I feel like this today, and try to correlate it to other things. Definitely come prepared with that if I've asked you to do that. And then if you have some complaints that are more than just one thing, like you said, Maddie, coming with a big list of, okay, these are the things that I want to talk to you about. And then if you can, give me a heads up about it, and then I can try to kind of do my homework behind the scenes before you get there. So we can make the appointment a little bit more seamless.
So as we both have chronic illness, I know Luisa, quick backstory. I know Luisa because we worked together at Children's Mercy, and you kind of helped me navigate what I wanted to do with my major a little bit. And you're just such an amazing person.
Oh my gosh, I'm so happy to hear that.
But Kyle also has, so you know my story a little bit, but Kyle has narcolepsy and then a thyroid disease also. And based on our experience trying to navigate, you know, care, obviously the electronic medical record is huge, and it's just not as seamless as we'd like it to be. But we tried to create kind of like a bridge for patients with our symptom tracking app that is coming out in the next few weeks, because we had so many doctors request us to, you know, document by hand our symptoms and then forget, or things like that. And so, you know, as patients, we really saw the need for kind of a bridge in that regard, because we had experienced so many doctors ask for more information, and it is a challenge to keep up with. Okay, this is lupus, this is narcolepsy, this is thyroid. I mean, all of the moving parts. But going back to telehealth a little bit, obviously you worked in telehealth prior to the pandemic. How was that kind of back story and experience, how was that useful as the pandemic kind of arose?
Oh my gosh. Well, I was lucky to be at the very forefront of telemedicine when I worked at Children's Mercy, and had been working on it for several years before the pandemic. And what I've noticed is there's a lot of, when you talk about bringing a new technology to someone, anything, regardless of whether it's healthcare or not, you're always going to have early adopters, and then you're going to have the late adopters. Well, the pandemic just really forced everybody to very quickly adjust and see the benefits of telemedicine. We had a lot of naysayers before about saying, it's not the same. There's no way we can deliver this, like X, Y, and Z. And come to realize, those people found ways to make it work and deliver healthcare to their patients, because at the end of the day, no matter what's going on, people need healthcare, and they need to be able to access it from their homes. And this is really the best and easiest way. The studies, I mean, and I got to do a lot of the at Children's Mercy, read the studies and look at the quality. The studies are amazing on telemedicine, right? They say equal or better satisfaction for patients to be seen at the comfort of their homes. And why not? We live in a society that everybody has their phone on them all the time.
Right.
Hey, something's happening. I can call a provider. I can see somebody right away. I don't have to wait 5 hours in a waiting room and get COVID while I'm sitting there.
Right.
So yeah, telemedicine has been a long time coming, and the pandemic really put it out there in full force, even with, reimbursement from insurance companies. That was nice for sure.
Yeah. So my doctors are all at Mayo Clinic, which is 8.5 hours away. And Kyle's doctors are, do you like how I talk? I fill in all these words. He does know how to speak, but I just do it for him a lot of the time. His doctors are in St. Louis, and it used to be between 8 and, when I was really sick, 8 and 12 times a year, I was going back and forth to Mayo Clinic, while in college, while in high school, while trying to have a job. But with telemedicine, Mayo Clinic's embraced it through the pandemic. I'm now able to see my doctors in Wichita, and it saves me 48 hours of travel and expense.
And the stress.
And the
of
stress.
Having to go
Right.
take off work. If somebody else has to go with you, they have to take off work. Obviously, again, the financial burden.
I think it's interesting also because something that we talk about a lot is the PTSD related to chronic illness, and the rate of PTSD and chronic illness is actually higher than combat veterans, but no one knows that. I mean, it's not talked about. And I remember working at Children's Mercy when I would bring patients back, kids as little as 18 months would start screaming when they were brought back because of the trauma associated with visiting the doctor. And I think telemedicine has also kind of helped address that PTSD, because they're still talking to a doctor, but it is from the comfort of their own home. Man, my words are not working today. And so it's been so interesting because obviously I don't have the extent of background in telemedicine as you do, but I did get to see it a little bit before the pandemic. And I just think there's so much positive that's come out of the negative of the pandemic. There have been some silver linings for sure.
I totally agree. And I do think telemedicine is one of them. I think we've just barely scratched the surface of what we can do. There's hospitals now that have teleneurology, where whole stroke centers that work that way and are able to provide really efficient and safe care for patients. Whether you have a neurologist in New York City or in Wichita, Kansas, you're able to see somebody who meets your needs.
Sure. Well, and growing up, my mom was always worried about taking me to the doctor because of the infection risk, flu season, cold season, I would end up with pneumonia. And that element has made it so much more accessible to people with chronic illness or compromised immune systems also. That's totally off topic, but super interesting because I totally wanted your perspective on how that's all kind of evolved. How do you think communication and kind of patient-centered care is evolving as the pandemic has brought up so many concerns about health and healthcare? And just, I think it was a shift that was happening prior to the pandemic, but even more so. How have you seen the way doctors interact with patients change?
Yeah, so I think, at least in my perspective, I always talk to my patients about like, okay, this is what the research shows. This is kind of where you're at. What do you think about that? I don't just tell them like, hey, we need to do this. We're just gonna do it. It's more about making a decision together. Shared decision making is really important to me, because I don't think that by forcing people to do something, I'm gonna do what's best for them always. There are some cases where I'm just like, I'm sorry, this is really what is best for you. And it's hard at times to have that be the feeling that I'm conveying to the patient. Sometimes not everybody's open to that, but I do think that you win more. What is it? Win more bees with honey, right?
Yes.
And meeting people where they're at is important, and a good way to get good results. Because if you tell somebody, hey, we need to do this, and they're like, no, I'm not going to do it, then you're not going to solve any problems, right? You're not going to do it. You're going to be upset. So if you can compromise and say, okay, well, today I had a patient needed to get a colonoscopy. It was time. Well, they didn't really want to do it. They're like, I don't want to do that. And I said, okay, well, it's been more than 15 years. You're about an age that we need to recheck this. But have you ever heard about this other option called Cologuard? Can you just, mail a sample, do it from the comfort of your home? And they were open to that. They were like, I hadn't heard about that. I would be much more open to doing that. And so now we got that ordered. It's about having conversations and listening to your patients when they tell you something, and coming up with the best way to serve them.
Yeah. So what's a way that you talked about you meeting a patient where they're at? How are ways that patients could come and meet the doctors or providers where they're at, and kind of meet in that middle? What are the steps that they can do that can, I guess, bridge it from both sides?
So I think that, coming to an appointment, being open-minded and willing to learn is always helpful. We come from a place of, okay, well, this is what we've been taught in school. This is what the data says. This is what the experts are telling us. Sometimes conveying that information to somebody who doesn't understand all that medical terminology is difficult. And if you're able to explain things to somebody in a way that it's more understandable to them, or you can convey the reason why it's important that we do X, Y, and Z, I do think that people are way more receptive to that.
Sure.
And I think if patients are able to say, okay, like my provider knows X, Y, and Z, and they're telling me this because they care about me as a person, then I think we can find a way that we can both meet in the middle and do something that's good for both of us, and that we get, good results. And, sometimes we do one thing and we're like, hey, we tried this and it didn't work. So now are you open to trying the next thing? And then, then some patients are like, you know what, yeah, we did try it, it didn't work. Let's do the thing that you wanted to do in the first place.
I think as a patient, on the other side of things, it makes such a difference when you walk into an appointment and the provider wants to have a conversation, rather than, I've had doctors, that are like, okay, well, this is what your labs say, and now we're going to put you on this really scary medication. We're not going to talk about what it is, but you need to do it, and cool. And then they walk out. And number one, it just makes you shut down completely as a patient. But most of the time, I'm not going to be compliant with the treatment if I don't understand it.
Exactly.
If I wasn't a part of that conversation. And I think the best providers, sometimes they're difficult to find for sure, but the best providers do exactly, what you do, and just sit down and especially make you a part of that decision-making process.
Yeah.
And I think it's been really helpful as we've seen doctors, who are okay with you researching your condition. So many people talk about, my degree, or getting defensive and saying, you know, Google isn't a medical degree, things like that. But as a patient, when your doctor doesn't have the time to explain things, it can be helpful to look into your condition and get some background information. Obviously, you're not going to have the same knowledge as your provider, but it just being able to be competent when you go to have these conversations about your health. And I think that kind of patient-centered care, we've seen some providers that are like, no, it's okay for you to look into your condition.
Right. Yeah. I mean, that's what I would do, right? Like, what else are you going to do? If you're concerned about something or you didn't get enough information, the first thing you're going to do is look it up on the internet, right?
Yeah. And I think that helps with the conversation, and especially the doctors that don't have the time or aren't willing to sit down and explain everything at that, you know, lower level that a common person could understand. I think it helps bridge those and for you to understand what the doctor's saying, and I guess have the doctor explain what you really need, other than starting from the bottom, which, you know, may take a long time. And some of these doctors in the big clinics don't have an hour to sit down with you and explain everything. So I think it helps kind of answer your questions that you really need to know.
And one other thing that I really like to do, and not everybody, you know, will read what I give them, but if somebody has a question, I'll say, okay, here, let me find a good reputable source. Let me print off some information for you. And then I know that I gave you the information that I trust. That you can read at home or whatever. And then if you have more questions, give me a call, you know, call the office or send me an email or whatever, and we can talk about it. And I think that's, you know, sometimes people get lots and lots of papers and they're like, I'm not going to read all this, right? Like, I totally get that. I can't think of the times that I go somewhere like, here's some paperwork. I'm like, I'm not reading that. But if somebody's like, hey, or I always ask at the end, like, would you like more information? Do you want me to print you something off about this? Or, and I have most of my patients tell me yes.
No, and anytime a provider's offered me more information, it's always something that I'm enthusiastic about, because not every provider does take that time and care about. I'm lucky because, you know, I go to Mayo and my doctors are phenomenal. But when I was seeing people that were specialists in Wichita, a lot of them, you know, didn't have the time to sit down and explain things. And anytime I was offered a resource, I was just hungry for some information about what was going on in my body. And I think it does help kind of that psychological component of chronic illness, because you feel like everything's going wrong in your body and you have no idea why or what's happening. And so when you do have that knowledge, it can bring a lot of peace to kind of the grieving process that accompanies chronic illness.
Well, I think along with the peace, it helps you also further along in diagnoses or treatment, knowing what symptoms kind of affect what. I think there's a lot of times, even like lupus and narcolepsy, we talk about like knowing the different types of fatigue, you know, being able to distinguish between, you know, what is my lupus fatigue, what's my narcolepsy, can help very much with treatment and knowing what, you know, what doctor to go to, or kind of narrow down where the problem's coming from.
So it's like a guidebook of saying, you know, hey, you may experience this or that. Here's some paperwork. It helps decrease the anxiety surrounding, you know, like what happens if this happens, you know? And you kind of do this mind shenanigan that you do when you're anxious, right? And I think having that information on paper is helpful.
No, 100%. So how do you, and you might not have a good answer for this, but obviously you're an excellent provider that prioritizes, you know, patient-centered care, making them part of the decision and education. Do you have any tips for people to find providers that kind of align with the way you practice? Like, how should someone go about finding a provider that really listens to them?
Yeah, so it's a transaction like any other, right? You go to a hairstylist, and if you don't like the way that they did something, you don't go back to them. It makes it difficult to track down the things that happen, you know, because of the lack of EMR, like we talked about, universal EMR. But you don't have to stick with somebody you don't like just because you've been seeing them for forever.
Mhm.
That's not, I know that that's harder, but you can try somebody else out.
Mhm.
A lot of people, though, I will say, are limited by their insurance, like who
Sure.
will their insurance cover, like, oh, they're out of network or in network. The nice thing about like Free State, for example, which people can always see me if they want,
Mhm.
um, is that it doesn't matter. We take all insurance, we accept cash pay, we work with everyone
That's awesome.
regardless of where they're at, which is the big reason why I was attracted to
Yeah,
this model, because it really aligns with what I believe in.
sure. 100%. And then I think the last thing we have is our segment called
Just the tips.
because we're 5. We own it.
Good
Okay. What are 5 tips you have for patients to come to appointments prepared and to kind of get the most out of primary care visit?
Okay, I would say bring a list of your previous medical problems.
Okay.
Bring all of your medications. Bring a list of symptoms if you're coming for something specific, or if you've been asked to track down symptoms. Come on time or 15 minutes before, and be open-minded and ask questions.
You whipped those tips out. Like, I'm impressed. I think those were the quickest tips we've gotten. She knew them. She was ready.
There you go.
Well, thank you so much for talking with us and sharing some of your experience.